Hey everyone, welcome back. Today, we're going to talk about something that a lot of pregnant women experience but rarely get clear answers on: rib pain during pregnancy. If you've ever wondered why your ribs feel sore or uncomfortable during those 9 months, you're definitely not alone. Many moms-to-be find themselves asking, why does this happen? Is it normal? By the end of this video, you'll have a better understanding of what's going on with your body, why it's happening, and what you can do to find some relief. Now, let's dive in. Problem statement: rib pain throughout pregnancy. Rib pain during pregnancy can really catch you off guard. You're expecting the baby kicks and the swollen feet, but sore ribs? Not so much. What's frustrating is how rib pain can be felt differently by every pregnant woman. For some, it's just an occasional ache, but for others, it can be constant and even disrupt sleep. It's important to understand why this happens and how to tell the difference between what's normal and what might need medical attention. Let's break it down by the trimesters. First trimester, early causes of rib pain. Believe it or not, rib pain can show up even early in pregnancy. It might sound strange because your baby is still tiny at this point, but certain things can start changing in your body right away. One big culprit is heartburn. During pregnancy, your body produces a hormone called relaxin. It does exactly what it sounds like: relaxes your muscles and ligaments to prepare for delivery. Unfortunately, this hormone can also cause the muscles in your esophagus to loosen, allowing stomach acid to rise up. This creates that familiar burning sensation, but sometimes the pain can travel up and feel like it's in your ribs. The discomfort can catch you off guard, especially if you're already dealing with the common first trimester nausea. Another potential cause: constipation. Yeah, I know, it's not glamorous, but it's real. Pregnancy hormones slow down your digestion, which can lead to bloating and even pain in the upper abdomen, sometimes near your ribs. Second trimester, the growing fetus begins to press on your ribs. Moving into the second trimester, this is where things start shifting more noticeably. The fetus is growing, your uterus is expanding, and soon enough, that little baby will begin putting pressure on the ribs. This is especially common later in the second trimester as your belly gets bigger. One major reason for this discomfort is simply pressure from the growing fetus. As the uterus expands upwards, it starts pressing against your diaphragm and ribs. This pressure causes muscle aches in your rib area, and it's usually mild to moderate. But if it ever feels severe, it's always smart to check with your doctor. Now, let's talk about round ligament pain. Your round ligaments are like stretchy cords that help hold your uterus in place, and as your uterus grows, these ligaments stretch and pull. This stretching can cause sharp pains when you move, sometimes affecting your ribs, back, or pelvis. Think of it like a rubber band that's stretched to its max. Any sudden movement can send a jolt of pain through the area. This type of pain is pretty common during the second trimester and is usually nothing to worry about. Third trimester, the fetus kicks into high gear. By the time you're in your third trimester, your baby is not only bigger but also getting more active. This is where the position of the fetus comes into play. Around this time, most babies flip into a head-down position, meaning their feet are now pointed right at your ribs. Ever been on the receiving end of a baby kick? It can definitely take your breath away. Those little feet are strong, and their movements can directly impact your ribs, causing sharp, sudden pain. And it's not just their feet, even their hands and arms can contribute to discomfort as they shift around and grow. On top of that, preeclampsia and HELLP syndrome are conditions that can cause upper right abdominal pain that radiates toward the ribs. Preeclampsia comes with high blood pressure, swelling, and other serious symptoms. These complications are rare but require immediate medical attention if they occur, as they can be life-threatening for both mom and baby. Other potential causes of rib pain. But rib pain during pregnancy isn't always about the baby or the uterus. There are a few other causes worth noting. One is gallstones. Pregnant women are at a higher risk of developing gallstones due to hormonal changes. Gallstones can lead to pain in the upper right abdomen, which sometimes feels like it's in your ribs. If this happens, your doctor might recommend surgery after the baby is born, but in some cases, it's manageable until then. Another surprising cause: urinary tract infections, UTIs. If the infection travels to your kidneys, it can lead to a kind of pain that feels similar to rib discomfort. If you have symptoms like pain when urinating, fever, or severe discomfort in your back or ribs, it's time to see a doctor. What you can do to find relief. Alright, let's talk solutions. First of all, it's important to understand that while rib pain during pregnancy is common, it doesn't mean you have to suffer through it without any help. There are a few ways to ease the discomfort. 1. Gentle exercise and stretching. Engaging in light exercise and stretching can help relieve the pressure and stretch out those rib muscles. Using an exercise ball, for instance, can help stretch the back and chest muscles, giving you some relief. 2. Heat pads. A warm, but not too hot, heating pad applied to the painful area can provide soothing relief. Just make sure to consult your doctor about what's safe for you. 3. Chiropractic care or prenatal yoga. Seeing a chiropractor who specializes in pregnancy or practicing prenatal yoga can work wonders for stretching and relieving musculoskeletal pain. The gentle stretches in yoga help release tension and align your body, potentially easing the rib pain. 4. Loose-fitting clothing. You might not think about it, but tight clothes can worsen rib pain. Stick to loose, comfortable clothing to avoid adding pressure to an already sensitive area. 5. Pain medication. With your doctor's approval, certain pain relievers can be safe to take during pregnancy. Never hesitate to ask for advice on this. When to see a doctor. Now, it's worth repeating that while rib pain is often just an annoying part of pregnancy, there are times when it's more serious. If you have symptoms like a fever, high blood pressure, or swelling in your hands and face, make sure to get medical attention. Also, if the pain is severe or accompanied by nausea, vomiting, or difficulty breathing, it's always best to check with your doctor. Conclusion. So there you have it. Rib pain during pregnancy can be caused by everything from heartburn and constipation to the position of the baby and conditions like preeclampsia or gallstones. While it's often normal, it's always good to know what to look out for and how to manage it. Remember, pregnancy is a wild ride, but you don't have to be in the dark about what's happening to your body. If you found this video helpful, give it a thumbs up, and don't forget to subscribe for more content like this. Let us know in the comments if you've dealt with rib pain during pregnancy and what helped you find relief. See you in the next one.